For the bradycardic algorithm, I will begin with my scene size up. Then I'll start my primary assessment. I will determine the patient's chief complaint and level of consciousness, and then I will ensure that their ABCs are intact. The patient will be taken to the ambulance where an IV will be established, vitals will be taken, and they can be placed on a cardiac monitor. I will interpret the rhythm. For the purpose of this assignment, it will either be sinus bradycardia or bradycardic arrhythmia, like an AV block. With this information and my general impression of the patient, I will then look for serious signs and symptoms, which are altered mental status, heart failure or JVD, chest pain, hypotension, or signs and symptoms of shock. If the patient appears unstable, I will begin with atropine at 0.5 milligrams every 3 to 5 minutes up to a 3 milligram maximum dose. If that does not work, I will consider pain management because I need to begin transcutaneous pacing. I will place the pads on the patient, set the rate to 70, and begin increasing the pacer output by 5 milliamps until I notice electrical capture on my monitor. I will confirm capture by checking a radial pulse so that it is the same as on the monitor. If the patient does not improve then, I can increase the rate up to 90. If no improvement following pacing, I will administer a dopamine drip at 5 micrograms per kilogram per minute. If the dopamine does not help, I can then administer an epi drip at 2 to 10 micrograms per kilogram.